Ladies and gentlemen, welcome to the final session of our event. It is now time to dive into the dynamic world of open innovation in healthcare. We will enjoy a lively debate with the key stakeholders shaping healthcare ecosystem. Together, we will delve into discussions of identifying these crucial actions needed for effective coordination among these institutions, with of course the objective of bringing tangible impact through innovative solutions in healthcare and ultimately enhancing health outcomes and the efficiency of healthcare systems. In this occasion, I have the pleasure to welcome back to the stage Germán Gutiérrez, Integrated Health Solutions Director of Medtronic Ibérica and Gatekeeper Project Coordinator. Of course, he will be surrounded by representatives from the public administration, industry, startup accelerator, and European Commission. I hope you still have some energy because this is going to be an amazing panel and I'm sure you are all going to enjoy it. So whenever he's ready, Germán Gutiérrez, the floor is yours. Thank you so much.
Well, we have come to the last roundtable of the morning. And, well, this is going to be, for sure, I think, a very, very interesting roundtable. We have a very diverse representation. Here we have representatives from the industry, although César Velasco, that is today the Innovation and Digital Study Director at AstraZeneca, has also worked in public administration and at hospitals. We have Patricia Pesudo, that is the Director of MES St. Pau's office in the Strategy and Transformational Office. Very, very interesting position that is very unique in European hospitals, although common in American ones. So I think this is a very good challenge, and you're going to bring a very interesting perspective. We have Mr. José Luis Fernández, that is coming from a startup accelerator, Kunsen. He is the managing partner at Kunsen. So we have the perspective of the real tissue that is innovating at the very heart of the system. And we have the perspective from the public administration, Ana Miquel, that is the head of the innovation unit of the Health Department of Madrid region. So our roundtable is about open innovation for creating sustainable digital healthcare ecosystems. So some keywords here. We have open innovation, we have sustainability, and we have ecosystem as keywords. So ready for a real exciting discussion? Well, I want to start just making a question to César. Because he's coming from the public sector, from hospitals. He's in industry from some years now. And I am personally from industry, and we know how difficult it is to break barriers internally in the industry about the difference between in-house innovation and open innovation. So, how is really approaching your institution, the industry, the concept of open innovation?
So for us, open innovation means understanding the healthcare system needs and also falling in love of the need and not falling in love of the solution. This is something that we've been trying to tackle for so many years, how sometimes we forget what we're trying to achieve when we are innovating, and we forget about the real patient needs, or we forget about the healthcare system or healthcare professional needs when we are designing a solution. And in this process, I think Europe can really make a difference because we are patient-oriented, we are people-oriented, and we need to ensure that the innovation that we do is healthcare system and patient-oriented. I envision innovation and open innovation in our organization as a bike. This meaning that I guess everyone in the audience does ride bike, or when you were kids, you were riding bikes, or your kids, maybe they're riding bikes now. There is a front wheel and a back wheel. The back wheel of innovation is the R&D. And it's true that the stronger the R&D is, the innovation of the back wheel is, the more difficult it is to ride a bike. And this meaning, if you go fast and you have really strong legs, you really need also to control the front wheel of innovation. So if R&D is strong, you have new technologies, new devices, new therapeutical innovation coming in the innovation bike of your company. You really need to read the environment, read the needs of the healthcare system, read the road, and understand if it's a slope, or it's a mountain, or it's a rocky way, and understanding the environment, designing solutions for the healthcare system, understanding the real needs of the patients that will receive the innovation that you are creating, also of the healthcare professionals that will use and adapt and adopt the innovation that you are creating is as important as the back wheel. I've never seen a bike that has a bigger back wheel than a front wheel. So healthcare innovation, solutions and services innovation, which is the front wheel of the innovation for our company, is as important as the back wheel. And for that, we need open innovation for so many reasons that will be also shared by my peers, and I think we will cover during the session. Thank you, Herman.
Wonderful. Patricia, exciting job that you have in your institution. So I would like to know how you balance all the innovation that is out there, that you detect that are needs in the hospital that can benefit of that innovation, and at the same time complying with all the regulations, public purchasing, IT requirements, so all the barriers that impose really a big challenge for all those innovators that are outside. How do you balance that situation?
Well, in fact, And the point is that till now, what we were doing was managing all the offers that we were receiving from the outside on, I have this solution, may you try it out? And what we want is to stop trying out the solutions that come from outside, from like in a reactive perspective, and starting doing it in a proactive way. What do I mean by that? Really align with what Cesar just said. We want to do it from the need. Within the framework of the strategic plan, what we are doing is using the most important resource that we have in the hospital, that is the talent, the professionals. So nurses, doctors, and engineers of the hospital, and identifying which are the projects through which we will be materializing the strategic plan. When I speak about projects, actually what they are identifying is the challenges, the real challenges that we have in the hospital. These challenges sometimes come challenge and solution, but the most interesting thing is that most times we get to have the challenge, and the challenge itself gives us a lot of information because it gives us the possibility of evaluating the cost of not covering that challenge. So, and answering the second part of your question, and what do you do afterwards to overcome the barriers, the internal barriers? So once we have this challenge identified, the evaluation of how much does it cost me not to cover this challenge, it is a time for the steering committee to prioritize them. So IT department, legal department, they are integral part of the steering committee. So once we do as a prioritization in the steering committee, all the people involved on the adoption of a solution for this challenge have to put all of us align the effort in order to overcome this barrier. So it is just model procedure and having a really clear and having prioritized which are our challenges in the hospital.
So if I understand well, you have the commitment and the engagement of the executive committee of the hospital,
Yep.
just pushing the prioritized initiatives.
That's it. That's it. It's a matter of a steering committee.
José Luis, as an accelerator, so which are the key drivers for the success and the challenges for the long term of this wonderful keyword of is sustainability? What is the key for sustainability and to avoid the high mortality of startups that is very high in this domain?
It is, it is. We were chatting about that before in the coffee break. And I mean, to answer the question, I will start with some of the key factors that I consider to be key for the success of healthcare startups. And then I can mention some of the challenges that we often encounter, especially when we go to market and we try to sell those products. I will start with one that I know is often said, and it can sound as a cliche, but it's true, the key factor for us, which is the team. And with the team, I mean not only having brilliant people behind the project, but also a balanced team. That's really important in digital health and in health in general. To have this clinical or scientific business part and the technical part, and how they work together, the three parts. And an important thing there, I think, is to align those three backgrounds and profiles so that all of them are on the same page, and having this person in the team, which often is the CEO, to bridge the gap between these different backgrounds, roles. I think it's really important. So we are really happy when we find these CEOs that have both the scientific and the business background or profile, because it really makes a difference. Another important thing or key factor, I would like to highlight the sales-oriented vision of the company. I know, of course, leaving aside the importance or the huge importance of generating scientific evidence and clinical validation, but apart from that, having this sales orientation within the DNA of the company, it's really important. I guess, especially when considering the length of sales cycles that we have in these sectors, and that startup phase when they go to sell, which normally goes from 6-8 months upwards, and that have a really big impact on their runway to effectively survive, no, and not die. And moving on to challenges. I mean, we have many here, I would say, but to mention two that we normally encounter, especially when going out and sell digital products. One will be the lack of budget, and with this, I mean, you normally don't find budget lines or pockets that ensure the purchase of these new solutions, but purchase them on a longer-term basis, let's say. Not a small contract or maybe a one-off project, but on the long term that ensure somehow the sustainability of the project. I think that happened a lot, especially in the public sector, in public hospitals. And I think things are changing, and we are having more and more instruments and mechanisms to adopt these kinds of technology, but I still think that we have a big need to tackle there. And another one would be culture, meaning that the lack of digital culture. I mean, a startup, when they go to sell, they need a person or people within the client organization that knows what a digital product is, what a startup is, what benefits these new solutions or technology can actually offer them, and I think there's a lack of that sometimes. I mean, we have two good examples here in AstraZeneca and San Pau, and we work with them. And I know there are these kind of proposals that really understand this reality, but it's hard to, I would say it's hard to find those profiles, and that's also a key factor for adopting. So training and trying to generate that digital mindset, I think, would be a big challenge to do. Kind of.
Yeah, well, interesting just to see the perspective that is not only about the innovation itself, but the team driving the innovation and the diversity of the team to make it a success.
That's it.
Anna, just a difficult question for you. That is about the innovation in healthcare paradox. Because industrial policies normally are pushing for creating innovation, but on the other side, healthcare administration is trying to limit these innovations coming into the hospitals and to the system. How do you balance these two forces? So industry generating enormous amount of innovation, and on the other side, healthcare administration just putting brakes on that, on the entry of that innovation.
Well, Germán, thank you very much for inviting us here to share this opportunity with friends, because we are all friends. In fact, I agree with you. So this scheme of the two wheels in the bicycle is, we say that the needs are in the earth and the opportunities are in Marx. So, in fact, the current situation is that sometimes the public health or the health organizations do not share, do not talk with the opportunities of the companies. But I think it can change. And in fact, we have some examples that when we change it, the results are very good. And I could give you a lot of examples. Many of the people that are here, or my colleagues, know that we try to change this every day. But I could give you an example with the public procurement projects that we have developed during the last 2-3 years, more or less. And the perspective from the professionals and from the public health sector is that we know the needs and we know how to solution them. The perspective from the companies, from the IT companies, is that we know how to build the solution and we know the needs. But in fact, we don't talk together, we don't do it together. When we put the open market consultation of these public procurement projects, about 78 companies participated. And it was a process of learning, a very, very interesting learning, because from our initial perspective of what we need and what we have to build to the last perspective, there were a lot of changes. We learned together. And after that, when we have developed all the projects, it has been a process of co-leadership, co-creation, and co-learning with all the participants, with different profiles, with the physicians, the nurses, the physiotherapists, the engineers, the companies, and all these more than 200 professionals working together have allowed the development of high-impact projects like Infobanco, Medigenomics, Integracan, that are very, very relevant and very impactful projects in a very short period of time, 1 year and 1 month. And the main key success was co-creation, co-leadership, with the different elements of these wheels of this bicycle. So my conclusion is that we can build a bridge between the Earth and Mars. But for that, we have to find the ways of working together. And probably public procurement is one of the ways of trying to work together. But there are another, and it is the introduction of open innovation in the culture of the health organizations. I think we need to change the culture, because now something is in the Earth and the other is in Mars. But we can build the bridge.
Thank you. Cesar, a wonderful explanation that you made about open innovation, but can you really make it more tangible? So give us a concrete example.
I will. Let me start with a reflection, because what Anna said was beautiful. You know, what I decided to start working in the industry and continue working in the healthcare ecosystem from an industry perspective, I was explaining to my friends, to some colleagues, that for me, healthcare systems or health systems are like rivers with two different sides that are sometimes like the Earth and Mars. And we need to build bridges in order to solve super complex challenges that we have together. And for that, we had public procurement of innovation as one of the bridges. And the other one, I agree with Anna, 100% is open innovation. I will explain you with a specific example. So when our company started working with heart failure, which is something that also Medtronic and other companies do really well, what they were facing was, do we need to think on what is the problem to solve, or do we need to think on what is our innovation therapy product that will come to the system? Usually what companies do is the second. We have a product, we have a technology, we go to what they call the market. When I got into the industry, I was like, oh my God, are they calling healthcare systems market? Why are they doing that? Like, this was my first impression on how we were discussing how to get into the market, kind of the go-to market strategy. And I was like, it's not a go-to market, it's a go-to system or a go-to ecosystem. And this is something I learned from you, Germán. Ecosystems don't have a CEO. Ecosystems have multiple CEOs. So how you do that? You do that with open innovation. So you first define what is the important need for the healthcare system you're going to be working with in terms of heart failure. This meaning you define, together with the healthcare system, what is the patient journey of heart failure and what are the bottlenecks of the healthcare system in heart failure. This could mean diagnosis or treatment or adherence or rehospitalization. There might be several of them. Then you need, once you do this definition, you decide which is the bottleneck that you are able to tackle together with your product and with a solution, with a bike. And you go to this bottleneck. You cannot be solving every different needs of the healthcare system in a patient journey, but you can decide being a partner of the solution or a partner for the solutions in one or two specific bottlenecks. Once you know that, you go to an open innovation challenge and you publish it. How do you do it? In heart failure, we were doing with different ecosystem accelerators. We sometimes do it with EIT Health. We do it also with Guaira. We do it with Hackathon Health, with different open innovation accelerators on the system. And we launched a challenge to the healthcare system, to the startups, to the medical doctors, to the nurses. So we receive different ideas, usually more than 40, from 40 to 60. We take these ideas into a funnel, prioritization funnel, and we decide to go with one or two for a pilot and validation test. And we do that in specific hospitals, like São Paulo, where they know how to validate an idea. There are some really good hospitals in Comunidad de Madrid too, where we can do that. Once we validate and we know that there is a good impact on this solution when it's being implemented, and in terms of heart failure, we are doing several. We are doing ECG recognition with artificial intelligence. We are doing voice recognition with the patient so we can predict hospitalization 30 days before hospitalization, helping the healthcare system implementing and validating that. And once we know that there is a solution that can cover this bottleneck, helping us as an industry to get to the patient, helping the healthcare system be more sustainable at mid and long term, because they will be more viable, they will be more sustainable, they will be able to purchase the innovation that we will bring in the future. And also, and most importantly, we are helping the patient being diagnosed faster or knowing that they're going to need a rehospitalization before so they can get some medication changes or some clinical care before hospitalization, and we are helping the system and helping the patient. Now we validate and we know that this works, we try to scale this up. And when we are scaling it up, we usually try not to scale the solution. We try to scale the methodology. And just for the audience, just for you to know, this is Germán. You were teaching me that. We cannot be scaling up solutions all over the healthcare systems, Germán. We need to scale up methodology, and this is what we do. Once we know that there is a solution that works, what we try to scale is, there is an algorithm that works in identifying heart failure faster. So we go to other healthcare systems telling them, you can do that with an algorithm. We can provide you with one that we've validated, but we can also help you on the journey of building your own if you don't want to work with the one that we have already developed, which is how we build a scale-up based on the methodology and not on the solution. This is a challenge for the startups we work with because sometimes we lose them on the go, but this is also an opportunity for some startups to work regionally and internationally, and then for other startups to be created or other spin-offs from hospitals to be created on-site. Because some of our healthcare systems, they prefer to create a solution when they know it works from scratch, but after doing all the process of open innovation, well, need definition, open innovation, validation and testing, and then scale up. And this is exactly the process that we do and that we are doing with heart failure right now.
Thank you, Cesar. Thank you twice.
Both learnings came from you, Germán, and I think that you deserve all the honors because you're a teacher for so many healthcare innovators. It needs to be acknowledged also.
Thank you.
Thank you.
So we enter into the sustainability landscape. So, Patricia, I always think about an innovation that is developed in a hospital, and is applied to that same hospital. That is the easy part. You co-create inside a hospital, you create the conditions, and then you apply in that clinical setting. But the real challenge is about bringing innovation that is developed elsewhere to your institution. So, are you federating efforts with other institutions in order to make the innovation developed elsewhere more sustainable?
That's the big question, because it is more difficult than it seems. We were talking about before, the big point for us till now has been identifying the big challenges and identifying the cost of not covering those challenges. But once you see that you need to find a solution, you look up in the market, the other way around, the other market. Do you have any solution for this challenge? No, nobody has it, so may we co-create a solution? But sometimes a hospital, as St. Pau, we don't have enough volume to be attractive for the private side of this group. So we are starting to work in order to federate efforts with other healthcare providers, but it is not as easy as it seems. So because although we are public and we shouldn't live in a competition, in the end there's a little bit of competition to see who is going to be the first one to do this or that. So it is not as easy as it seemed from the outside. So what we are doing before trying to do this federation of efforts is to start to build trust. Because what we saw that it was about building trustful relations between private and public, but public and public organizations, so that we will be able to do win-win collaboration. Because it seems not, before I was in the healthcare ecosystem from the public side, I couldn't believe that there's so many competitivity in order to do the thing. So I believe that we are in a point that we need to build trust relationships.
What a challenge.
For all of us, as an ecosystem.
Not easy, yeah.
Anna, how do you create, or how do you contribute to create sustainable innovation ecosystems?
Well, how can we contribute? Well, this is the key element now. Now, probably more from the perspective of a startup, because the trip of a startup, for example, is we create something that is relevant, but now how can be adopted by the health system? How do we do it? Usually, we try to first we try to cover all the elements of open innovation, from the need, from the idea, of one professional, one department, or that feel that we have a need, and we try to build this gate or this bridge of to transform the idea in one project, and then after to promote the scalability. And this is something quite difficult. But how have we done till now? When I go back to the example of public procurement, for example, public procurement is the way in which we introduce innovation in our normal management structures, or in our normal management procedures. And it gives us the opportunity of introducing from the designing of the project and of all the key elements of the organization. The public health organizations are very complex, you know. In fact, we cannot talk about one organization. We could talk about a lot of different organizations in one. We have the same problems with part of our organization that probably he's facing when he wants to scale one of the solutions. But public procurement gives us the opportunity of introducing the persons that are going to be responsible of scalability from the beginning. And this is what we have tried to do. In fact, our projects have a scalability plan included in the project. It is not only the solution, it is also the evaluation of the solution, the evaluation of the impact, the evaluation of the implementation, all the documents to support the projects, to make it very easy to be scalable. But also the scalability plan that has been designed by the persons that are going to be responsible of this scale. So I think we have to count with people that are in charge of the strategy and of the designing of the strategy, of the implementation of the strategy, of the designing of the projects that are in production in all our services, to count from the beginning when we talk about innovation, because they have to feel that this project is also their project. And so I think we have to find this communication of all the key elements of these complex organizations to try to mix the strategies from the point of view of innovation and the strategies of the health services. And to count with the people that are going to be responsible for them is one of the key elements. And if you can write it in a plan, better. And if you can follow up this plan, better. And if you reserve a budget, better. But count with the people that are going to be in the implementation. Otherwise, probably it can be lost with a lot of effort, but it will be lost.
Mm-hmm. So again, to the co-creation piece and the importance
co-creation
of...
from the beginning, not at the end, from the beginning. And with different tools that can help, okay? So show the impact, share the impact, share that this is something really innovative. And innovation is not to put something new, just that. It's to put something that really doesn't exist before. And to show that you can add value in a big sense of value, not only economic value. You can change the impact that you offer. If you show that this solution gives an answer to your needs, you build the solution together and you show that you are very impact, and you build the scalable plan with the person that is going to be responsible for this implementation, probably we have the key elements of this scalability. For that, you have to change the culture. And from my perspective, sometimes when we talk about innovation, we don't talk about the same thing. Okay? And in fact, I, again, agree with Cesar that sometimes innovation is part of the implementation of science, not only in the designing, also in implementation. And it is the great loss of our system in general, in Europe, and also probably in the world. But for example, in the United States, we have what we call the implementation of science. And this is something that is not very well known here. So we have to work together in this implementation of science too.
So when I hear all these perspectives about ecosystems, about open innovation, everything seems too handcrafted, so not industrialized. And normally scalability comes with industrialized approaches. So how do you think that we can industrialize a little bit the open innovation, the ecosystem play, so that we can create replicability and scalability. Because for me, it's like this very bespoke. So how can you really see the way forward in order to be more structured? We have with processes that enable to industrialize a little bit the way to implant innovation at hospitals. What is your perspective?
I think there are a lot of ways. It depends on what we are talking about. Probably with some products that are in a TRL, more advanced, more next to the market, it is more easy because it gives more an answer to the needs. And it is more impactful. It is more easy to show the impact. And we have an example. We have a common example. We have Better at Home. Better at Home is a project that was an EAT project, was chosen as one of the main innovative projects in 2021. It was with Hospital Infanta Leonor from Madrid Health Service and Medtronic, for example, and the scalability was being developed when the project hasn't finished. Why? Because it gives an answer to one relevant need, because it was very easy, because there was a very strong leadership of clinicians and managers of and there was a co-leadership of the project, and because it was very easy to scalable to another possible cases. And for you, it is not difficult to industrialize Better at Home.
Sure.
It is, I think so. But for example, now some of our projects of public procurement are being sold to another communities. In fact, because they are very next to the market, because they are very complete projects, they include all the solutions. So when you have a solution that you just have to use implementation and science to adapt to the context, it is more easy to industrialize it. Another situation is with some startups, with some digital devices, with some that now all the procedure to be adapted is very difficult. It's quite long, it has a lot of bottlenecks, and we have to make a lot of changes in this process of adoption, included regulatory aspect, included criteria, included a lot of things. We are trying to work together with an EIT Health report that will be published, trying to solve these bottlenecks. So industrialization depends but I think it's possible. And in fact, it's something you could tell us about your solutions, because some of them are being industrialized.
José Luis, what can we offer to startups in order to help the companies to industrialize their offering to the market? So which kind of services, the catalog of services that industries, hospitals, other actors in the system can really offer to startups to help them to accelerate their impact in the market?
Well, I agree with what Anna was saying, like the role of big players as Medtronic, and it's really, I mean, it's key in order to make that scalability possible. And actually, in our portfolio, the successful cases that has scaled till a certain degree is because someone from the industry has taken them and moved them geographically and even internationally, and that allows the scalability. Otherwise, as Anna was saying, just the startup by itself and trying to scale step by step in different hospitals or companies in the industry, it's quite challenging. services that can be offered, I don't know if in order to scale, but to enter the market. I really like what Anna was saying about involving all the parts, and that's actually a service that exists in the market, but I would say it's not really affordable for startups. It's often offered by consulting firms that what they basically do is organizing workshops or a series of meetings in which they involve all the key roles in a hospital, from the clinical part, IT, compliance, the management team. And in those workshops, at first they ask, what are their needs in that specific area? Let's say we are talking about dermatology, or so that the startup can realize how they can adapt the solution to the actual needs. And then they get to know what they have to do in order to implement it in terms of compliance, IT, to do the integration, and also what kind of data or KPIs the management members want to see in order to adopt or implement that. And doing these workshops or meetings at once, I mean, for the startups is a game changer. I mean, they can really build better value propositions and build a roadmap and a go-to-market strategy much more efficient. Yeah. So I like that approach a lot.
Well, yeah.
I think that there's one point that could help a lot to fast track, a potential growth, is that if we were able to identify the challenge, but not the challenge of one hospital, not the system. What are the system could identify the top 3, top 5 health challenges for the next 5 years. So in this case, industry, do you have solutions for these top 5 challenge? And if so, your solutions will be fast-tracked on the adoption or on the validation, etc. But from my point of view, I think that we haven't done this exercise of doing which are the top 3, top 5 healthcare challenges at national level, and it would help us a lot, personally.
As a matter of fact, it is sometimes difficult to put your solutions in the agenda. I don't think that we should be doing that as an industry. We should be understanding the agenda of the healthcare systems and trying to help them with their agenda and our solutions and services portfolio together with our products. That's something that is difficult. What I think in order to solve the equation is based on ecosystem leadership, 3 pillars. First of all, as Anna was saying, we need a structured plan and strategy, which is based on KPIs. There is no planning without KPIs, and if the KPI that you have is not putting just a product into the market, but improving people's health. In our case, for example, right now, we know that chronic kidney disease is a major threat to the population. There is many people in dialysis. There is many people going through a transplantation process, and we know that diagnosing CKD faster and in the earlier stages of the disease will have an impact on KPIs of the public healthcare system. It will also have an impact on the KPI of the patient, because if any of us would have CKD, we would want to know that before in order to get control. And it also has an impact in our industrial way of working, because there is something that we can put in the healthcare system that can change that. So now that we start an open innovation process and we try to build different projects in order to diagnose faster with data, with healthcare system, artificial intelligence, embedded algorithms in order to identify those patients faster, with retina imaging, trying to diagnose it through an early screening with retina imaging, different ways of doing that. Every tactic, every methodology, every solution responds to a methodology that responds to a KPI that is relevant to healthcare system and patients. And then this would be the first pillar, methodology and KPI. there are two more pillars which are as important. Knowledge, the leadership of the competencies. We need people that are competent in building bridges between the two sides, and there are not so many of those. I know that Patricia struggles with that, Kunsen is struggling with that, Jose Luis, Anna struggles with that because there are not so many. We struggle with it. There are not so many talented people in the ecosystem that know about IT, management, healthcare provision, patient proms and prems. There are not so many who know the 360. We need leadership of the competencies. And last but not the least, we need the leadership of the intentions, of the purpose. There is no leadership strategy. There is no challenge that any of us would follow if there is a clear KPI and a clear methodology. There is clear competencies and clear talent, but there is no clear purpose. Why do we want to do that? Why do we want to do that? Why do our companies, our healthcare systems, public ones that we represent, our startups want to do what they do? If we are clear on the purpose and the purpose is right, then we can make it happen and we can make those bridges together.
Yeah. You speak like an apostle. Well, so unfortunately, we have come to the end of the session. I think this is a very vibrating field. I cannot imagine the future of healthcare systems. I cannot imagine the future of digital transformation. I cannot imagine the future of AI without animating ecosystems, creating leaders, but also creating a structure and more industrialized processes. So I want to thank you very much for this very interesting session. Thank you for being a leader in just creating this and sustaining these ecosystems. And well, I want to just to thank you all for being with us here, celebrating the success of Gatekeeper, and also to embrace the future of digital healthcare. We need you just to make this change in the healthcare system. The healthcare system needs all the brilliant people that are seated out there and also online. This is a movement. This is about creating apostles. And I expect that you enjoy the rest of the day in Madrid and also the cocktail that is prepared just afterwards. So thank you very much. Enjoy, and really thank you for being here.
Thank you. Thank you.
Hello. It's me, Giuseppe. So, we are gatekeepers. Let's not forget that. Therefore, despite the connection problems, I have the honor to share with all of you and us two messages. One is from Dr. Janos Tolias, the first connection we could not establish. Just for being clear, Janos Tolias has been and is one of the most relevant person in charge of some of the regulations that have been mentioned today. I'm referring to the European Health Data Space. Two partners of this project, PredictBuy, they did the cost effectiveness analysis, among many other things, together with our research group, and Ernst & Young issued a report for cross-border exchange of AI and digital health services across Europe. And this informed the European Commission for the European Health Data Space. And as many of you may know, you have been part of this report because we brought, among many others, gatekeeper experts to inform while we were innovating. Janos say hello to all of us and is waiting to all of us in Paris on the Health and Tech Summit, 12 and 13 of December. If I cannot make it, go there and be gatekeeper, and let's continue the things that we are doing. Second, and not least important message is from Giovanni Gorgoni. So he is also a gatekeeper. Puglia, you may know that among other piloting gatekeeper has been always a 4 or 5 star reference site for active and healthy aging. If you don't know what it means, look for information or we will tell you. But this means having an ecosystem fertile for innovation on health and well-being. Therefore, before going to the closing session, we have a video from Giovanni telling to all of us the nice things that the Puglia region is doing and related with digital transformation. So bear with us, the video from Giovanni, and then we are closing. Thank you.
Good afternoon, everyone, and so sorry not to be with us. I would have liked to be with you, and also technology was not an ally from us. Today I have just a few minutes to send you a warm greet, a warm hello, and above all to outline three main pillars who permitted to Apulia region at this date to see enrolled 12,000 patients and complex patients such as cancer patients in our digital care platform in Apulia region. Basically, we try to implement user experience and to digitally enable user experience of the patients using the concept of a pathway as a method, basically using also the ability as a condition to make the path seamless, fluid, and so on. And ability comes from Latin, that means able, and able from habilis, that means that can be held literally in hand. And third, the change as mindset. Change as mindset means that without organizational and cultural change, we cannot make the best use of the best technology and ICT tools and leverages. So happy to and glad to join this consortium, and I warm guard the hope to continue this community not only of innovation but also of practice to digitally enable and not just digitalize the chronic condition as any other daily experience that citizens, users in the habit of patients live every day. And that's it. Thank you so much for your contribution, for the useful and productive exchange of thoughts, opinions, experience, and so on. And see you soon.
Thank you so much. It's been a great pleasure to be conducting this gala today, where the Gatekeeper team has demonstrated that innovation can help citizens to improve their health, their well-being, so their lives. I can only encourage you to keep on working on that direction, so giving the possibility to more citizens of benefiting of the artificial intelligence in their daily lives. Again, thank you so much for all the speakers that we have had here today, both in person and virtually, and to all the audience that have been here with us and also via streaming. So now I'm going to leave you with the Gatekeeper coordination team to officially close this vibrant event. Thank you so much. See you soon.
Okay. We are arriving to the end of this event. We are really proud having presented our speakers, invited speakers, participants of the project that have shared with you the experience of Gatekeeper, but also where Gatekeeper is inserted, because with the contribution of our guests, our
invited personalities, we really understand the complexity and the opportunity that projects like Gatekeeper and for the organizations that participate in Gatekeeper as facing in the future. So thank you very much to Gatekeeper colleagues that have been here today, and thank you very much for the invited that will come to share the experience with us. Here we have a part of the coordination team. We have been working 4 years. It's interesting to say that we are now approaching the end, in few days, the formal end of the project. This project, as demonstrated today, and we understood today, the insertion of the most relevant and important issues that we have nowadays in our healthcare systems in Europe. But this project was thought 5 years ago. As was said by Giuseppe, in the dinners, informal meetings, the idea of the Gatekeeper, I remember the times, was cooked. It means that at least we have the vision to anticipate, probably not without significance, but we have the vision in that moment. So I want to present you that Paula, who has been taking care of all of us every day during the 4 years.
Thank you.
Thank you, Paula.
Thank you, Sergio.
Incredible work.
Thank you.
You deserve all of this.
Thank you. Thank you.
Okay? Thank you, Paula. And then I want to give the last 20 seconds because one person is hiring us to finish, to Giuseppe, and to conclude, Germán.
Yeah, thank you. Well, at the beginning, I was giving you my definition of the Gatekeeper after 4 years of work. I repeat it, because repetita iuvant, like the Latin says, secure and protected environment, Germán, for an ecosystem of trust between industry, government, academia, and communities for active and healthy aging. That's our definition. And yeah, no more words from my side. Thanks for being with us for these 4 years. And as I'm starting to say, and please be convinced, Gatekeeper is not finalizing, it's just starting. Yeah. Thank you.
So from my side, I want to be very short. I ask you to give a big applause to the person behind this fantastic event. Lydia, please come to the stage.
This was not prepared. This is a cliché, but this is real. I just want to say thank you to everyone, because behind this, this is not me. This is a lot of people behind with all the sessions, all the preparation. So thank you to everyone. And this, well, for me, it has been a pleasure to work with all of you. Thank you. We did it.
And now, yes, enjoy Madrid.
Yes, we can enjoy the cocktail.
Just after this.
Thank you
Thank
so
you very
much.
much.
Thank you.